Hi, good afternoon. My name is Karen Stout, KarenStoute. Today is June the 13th, 2025, and I will be completing my assessment video. Here is Fatima. She will be my patient Sarah, and Jonathan will be videotaping. You can flip the video to show yourself. Also, Jonathan will scan the room and let you know that there's nothing else in here but our bags. All the equipment was pre-cleaned in the beginning, and I will start my video. Hi Sarah, good afternoon. How are you?
I'm good, thank you.
Good. I'm here today because I understand you came in because you have a rash.
Yes.
Okay, so I went over your the chart when you went to see the triage nurse, and I will be asking you some further questions, okay? So I see you have a rash on your neck. Could you let me know when the rash began?
2 days ago.
Okay, does the rash hurt?
A bit, yes.
Okay, from a scale 0 being no pain, 10 being the worst pain you've ever felt, how would you describe the rash? What can you rate?
Number 3.
Number 3, okay. Have you used anything on the rash?
No.
Have you taken any oral medication for the pain?
No.
Can you also talk about discharge on your eyes? Have you used any eye medication?
No.
Any nasal congestion? Any thing for the sore throat?
No.
Okay, are you allergic to anything?
No.
Okay, and how would you say that this rash has affected your daily activities?
It's painful and I can't sleep well.
Okay, perfect. So what I'm gonna do is I'm gonna do an inspection of you, and I can see that you're sitting upright. I can see that your cantor is very good, your posture is very good, you're upright, your skin color is correct for your ethnicity, your hair is well groomed, you're wearing the right clothes for the weather. It's a little hot outside, sorry, so I'm just looking. So what I'm gonna get you to do is I'm gonna get you to get up, and I'm going to have you take 2 steps forward and 2 steps back. Okay, perfect. So again, I can see your posture is good, your gait is very good. I can also see that you're not disoriented or anything like that. And I'm gonna ask you some questions. May you please tell me your full name?
Fatima Fanda.
Okay, and could you tell me where you are?
At the hospital.
Perfect. And what date is it today?
June 14th.
Okay, perfect. So what I'm going to do is I am going to use hand sanitizer. I'm going to touch you. Are you okay with me touching you?
Yes.
Okay, so I'm going to sanitize. If anything at any time hurts, please let me know. Okay, the first thing I'm going to do is I'm going to palpate your head. Okay, I don't see any lesions. I don't see any scarring. Does anything hurt?
No.
Okay, your hair is full, evenly distributed. Okay, your head is cephalic. That means that your head is round. Okay. Okay, very, very nice. Okay, so I'm gonna get you, because I'm gonna check the cranial nerve number 7. So I'm gonna get you to close your eyes as tight as you can. Okay, I'm gonna get you to raise your eyebrows. Perfect. I'm gonna get you to smile. Perfect. I'm gonna get you to frown. Okay, and I'm gonna get you to puff your cheeks out. Perfect. So cranial nerve number 7 is intact. I can see you're in a very good mood and you're enjoying the test, so that's pretty good. I'm gonna move on to your eyes. I'm gonna do hand sanitizing again because eyes are very susceptible to infection. Okay, so what I'm gonna do is I'm just going to touch around. Okay, so when I'm looking at the eyes, I don't see any crustation. Your eyelashes are full. Your sclera, which is the white part of your eyes, they're not red. Do you mind just pulling down your eyes a bit? Okay, let me just help you. Okay, just gonna pull down your eyes again. Perfect, okay. I can see that it's not red and inflamed, okay. So I'm gonna check the size of your pupil, okay. And it's a number 3. Okay, they're round, they're symmetrical. Your pupils are round, symmetrical, and even. And I'm going to just check how your eyes react to the light. Okay, perfect. So they're both reactive to light. Okay, I'm gonna do something called a cardinal gaze, okay? I just want you to look at the silver tip. Don't turn your head and just follow. Perfect. So this tells me that cranial nerve number 3 is in check. Okay, I'm gonna go to your ear. Do you have any fresh piercings or anything? Okay, so I'm gonna touch your tragus. Okay, and your helix. Anything hurts in that area?
No.
Okay, perfect. So there's no discharge. There's symmetrical. No cauliflower ear. Okay, perfect. So what I'm gonna do is I'm gonna pull your ear up and back. Okay.
Yeah.
So. Okay. So looking in your ear, I can see the tympanic membrane is gray. It's pearly gray, which is good. That's what we want. Am I hurting you at any time?
No.
Okay. All right, sorry, I didn't
No,
just shine
that's
in your light. I'm gonna do it to the other one. Perfect, okay. There's no unusual discharge. Actually, there's no spots or anything in the ears, so that's pretty good. So I'm gonna move on to your mouth. Okay. Okay, so your lips are nice and even. Everything's good. Could you give me a big smile? Okay. Good. Can I see your teeth? Okay. So I'm just gonna use a tongue depressor. Are you gonna be okay with that? Okay. Could you open up? Okay. I see no missing teeth. I see the tongue is aligned. It's pink. Okay. Just gonna take a look at your gums, okay? Just let me know if anything hurts. Okay, perfect. The gums are pink. I can see the hard palate is kind of whitish. Could you give me an ah?
Ah.
Perfect. Your soft palate is nice and pink. Your tonsils are +1. Your tonsils aren't very big. Your uvula reacted correctly when you said ah. It went up. Okay. So right now I'm just going to check your nose. So your nose is symmetric. Everything is good. I can see that there's no crusting or anything like that. So I'm just going to ask you to close one nostril. Could you snip up? Perfect. And could you do the other nostril? Perfect. So I'm going to give you 2 different flavors and smells, I should say, and I would like you to tell me what you smell. Close your eyes. Close one nostril. Okay. What do you smell here?
Vanilla.
Vanilla. Perfect. And could you close the other nostril? And what do you smell? Coffee. Perfect. So cranial nerve number 1 is intact. So this concludes our assessment. I will document everything and give it to the doctor, and he will be in touch with you shortly.
Thank
Okay,
you.
you have a wonderful day.
Thank you so much.
All right, thank you.